isn't like other forms of insurance. It's not protection against the unlikely, it's insulation against the inevitable. Almost everyone uses their health insurance eventually. If we repeal the Affordable Care Act, we would revert back to a healthcare system that was deeply flawed to start with. The Affordable Care Act was signed into law in 2010, and it provides affordable health care to all, and it provides health care regardless of pre-existing conditions, so they cannot deny you coverage and they cannot drop you if you do become ill. It has extended coverage for people up to 26 years old, and you cannot be charged based on your health, be charged more based on your health status or gender. And so according to the Congressional Budget Office, the coverage so this was recent, and they made this report in April, and that February 2014, the CBO and the JCT now estimate that the ACA, which is Affordable Care Act, coverage provisions will result in lower net costs to the federal government, and the agencies currently project a net cost of $36 billion for 2014, which is $5 billion less than the previous projection for the year. So the Affordable Care Act, and another thing from the CBO, is that the CBO and JCT have updated their baseline estimates of the budgetary effects of the ACA's insurance coverage provisions that many times since the legislation was enacted in March 2010. As time has passed, the period spanned by the estimates has changed, but by year-to-year comparisons show that the ACA's insurance coverage provisions have decreased on balance of the past 4 years. So what they are finding is that the costs are being lowered, and that an article that actually came out yesterday in recent findings that from the CNNmoney.com, and 8.1 million people have selected insurance plans within this first opening of the Affordable Care Act in exchanges during that, which ended on March 31st. And they have found that over 80% of those enrollees have paid their premiums. They found on Fox News that top health insurance companies told members of Congress Wednesday that more than 80% of the people who have signed up under the president's new health care law have gone on to pay their premiums. And this has been more than what they had predicted to be in the first place. They were saying that it doesn't matter how many people sign up, it's if people are paying their premiums within the first signing up of the first of the year. So what I found is that it is working. People are signing up. That is over 8 million more people that have insurance. And in 2008, there were 45 million Americans that had no health care coverage. So that number has definitely decreased over the time. And the White House press secretary, Dave Carney, states, it shows that the marketplace health care costs have gone down because the premium estimates have gone down. And that was found in April of this year. So with the healthcare costs of $104 billion less over the next decade, the premiums for private Obamacare plans came in lower than the agency expected. So what my opponent had mentioned about the being forced to have health insurance, technically they're not forced. The only thing that is being forced is the fine. So you're choosing not to have health care, you will have to pay a fine, but that fine goes into like the pool of money, which is for people that ends up paying for those people who are choosing not to have the health insurance. They have to be covered somehow. And the argument is, well, what if I'm healthy and I don't need health insurance? Well, that's what I said in the beginning, that insurance, you are inevitable to go to the hospital, you need health care, and definitely with the Affordable Care Act, it is making it affordable, and it is working in recent findings within yesterday, and we should not appeal the Affordable Care Act.